So in this session, we'll study ophthalmic artery and ophthalmic vein. As you see in this diagram, ophthalmic artery takes origin from the internal carotid artery when it pierces the roof of the cavernous sinus and medial to anterior clinite process. So it passes in the same dural sheath as the optic nerve. Then it pierces the dural sheath and curves on the lateral aspect of the optic nerve and passes from lateral to medial side above the optic nerve. Here it will be related to superior ophthalmic vein anteriorly and nasociliary nerve posteriorly, and it passes forward along the medial wall of the orbit and terminates by dividing into supratrochlear artery and dorsal nasal artery. And if you observe, there are so many branches. So one of the most important branch will be the central artery of retina, so which supplies the optic nerve and the inner 6 to 7 layers of the retina. And then you can see these are the posterior ciliary arteries. So these are the posterior ciliary arteries. There are two long posterior ciliary arteries and 6 to 7 short posterior ciliary arteries. These long posterior ciliary arteries comes to the peripheral margin of the iris and anastomoses with the anterior ciliary arteries, which are the branches derived from the muscular branches of the ophthalmic artery, and they form an arterial circle supplying the iris and ciliary body. The short posterior ciliary arteries will divide into plexus in the choroid and supplies the choroid and outer 3 layers of the retina. And if you see one of the lateral branch, so this is the lacrimal artery which passes in relation to the lateral rectus muscle. It is giving a recurrent meningeal branch which anastomoses with the middle meningeal artery, and it is also giving zygomatic branch which divides into zygomaticofacial and zygomaticotemporal. It is supplying the lacrimal gland. It is also giving the lateral palpebral arteries. It also supplies the lateral aspect of the conjunctiva. So conjunctiva, eyelids and lacrimal gland are supplied by the lacrimal artery. And here you can see this ophthalmic artery is continuing along the medial wall of the orbit. You can see here posterior ethmoidal artery which supplies the posterior ethmoidal sinus, and you can see the anterior ethmoidal artery supplying the anterior and medial ethmoidal sinus. It also supplies the anterior superior part of lateral wall of nose and the nasal septum. And you can see here the medial palpebral branches which supplies the medial aspect of the upper and lower eyelid, and these anastomose with the lateral palpebral arteries of the lacrimal artery. And here you can see the terminal branches. This is the dorsal nasal branch and supratrochlear branch, and here you can see an additional branch, the supraorbital artery. The supratrochlear and supraorbital arteries supply the forehead and scalp. So this is the ophthalmic artery. The most important point to remember, which is having clinical significance, is the central retinal artery is the end artery. So any obstruction or damage to this artery will leads to the complete blindness in the affected eye. Now there are two ophthalmic veins, superior ophthalmic vein and inferior ophthalmic vein. Superior ophthalmic vein starts from the upper eyelid. So as it passes, it receives all the veins corresponding to the branches of the ophthalmic artery. So it drains into the cavernous sinus. Inferior ophthalmic vein begins in the floor of the orbit. It collects blood from the lower eyelid. It also collects blood from the inferior muscles like inferior rectus and inferior oblique. So either it drains into cavernous sinus or it drains into the superior ophthalmic vein. So here you can see the inferior ophthalmic vein draining into superior ophthalmic vein and ultimately draining into the cavernous sinus. Here you can see the direct continuation into cavernous sinus, and below you can see through inferior orbital fissure the inferior ophthalmic vein is connected to the pterygoid venous plexus. So this is about ophthalmic artery and ophthalmic vein.